far. So, as Melody said, my name is Khaliyah Legette, and this summer I spent 3 weeks in Nairobi, Kenya at the Untitled Children's Home, which was the first residential facility for children infected by HIV in all of Kenya. And so throughout the course of my research, I had the opportunity to talk to the executive director of the Untitled Children's Home, to students who are currently there, students who graduated from the program, and other people who spend their lives invested in the community that is suffering from HIV and AIDS. So before I begin, I would like to thank the CSJ, Berkley Center, Melody and Andrea for guiding me through this research, thank the Untitled Children's Home for hosting me, my friends for coming and supporting me, and for the other fellows who supported me, those late nights sending messages, trying to figure out how we were going to present. Thank you so much. So I gave my little introduction, and this is just me pictured with 2 of the students at the Untitled Children's Home. So as previously mentioned, I conducted my research in Kenya, a country in East Africa, as pictured on this slide. So here I've highlighted Nairobi, which is where the Untitled Children's Home is, as well as the 8 Leototo program sites, which I will explain later. And I've also highlighted Kitui, Kenya, which is the location of the Nyambani village, which I will also explain later, that I had the opportunity to visit. So before I begin, I'd like everyone to take a moment and think of what the word home means to you. What feelings, concepts, emotions does this evoke for you? And just keep that in your mind as we go throughout the whole presentation. And so in order to contextualize my research, I would like to give a quick background of the AIDS epidemic. So out of all the people in the world living with HIV, approximately 68% are said to be in Africa, despite the fact that the region is only 12% of the world's population. To demonstrate how severe this epidemic was, consider this fact. Over the period from May 1986 to February 1987, less than a year, the number of cases of AIDS recorded by the World Health Organization rose from about 30 to more than 2,600 cases. Specifically, Kenya experienced its first case of HIV in 1984. And from 1984 to 1989, due to a period of being unaware of exactly what HIV is, it wasn't seen as a threat to Kenyan society. But this 5-year period led to very devastating effects. So much so that by 1999, the Kenyan government declared HIV and AIDS a national disaster. And so, while stigma and discrimination negatively impacted all people infected by HIV, unfortunately, children became a substantial portion of those affected. The millions of children in Africa abandoned or orphaned by HIV were physically, emotionally, and economically at risk. And many of them lived in the streets of African cities. So this is the situation Father Angelo D'Agostino found when he was called by God to change his life direction. So in 1992, faced with the calling to help these HIV-infected children, Father D'Agostino, as pictured here, lovingly called Father Dag, founded the Children of God Relief Institute, Nyambani. So Father Dag, a Georgetown alum and former professor here, founded Nyambani under a holistic care vision of care, or a vision that included physical, medical, psychosocial, spiritual, and moral care. Unfortunately, he passed away in 2006, but his legacy still lives on throughout the 3 program sites. So going to this research, I had quite a few questions about the care for this vulnerable population. And so as you see here, I had a few questions, which all kind of culminate into this final question that I have bolded here, which I will choose to focus on in this presentation. It's why does Nyambani use a holistic vision of care as a central approach when supporting HIV-affected children? And how is this enacted at Nyambani? So here I have the different aspects I will focus on. And I just want to say, when I went into my interviews, I was actually really amazed by the fact that without even prompting the question of asking about holistic care, somehow it was always brought out by the interviewees. They always had mentioned, well, this is a holistic care, this is a holistic approach that we take when caring for these children. So the physical. So at its most basic level, Nyambani provides a physical home for these children. In Nyambani, there are cottages which are comprised of 16 children and 1 mom or uncle. So these moms and uncles serve as the parental figures in these cottages. They do the cleaning, they wake up the children, wash their clothes, arrange lunch and dinner, and offers emotional support and, when necessary, even enact discipline. In fact, the word nyumbani means home in Swahili. So, medical. The sole characteristic that sets these children apart from any other child is simply their medical condition. Thus, medical care is a crucial aspect of their care. So without going into too much detail for sake of time, from Nyumbani's inception, Father Dag lobbied for these children to have access to antiretroviral medication, without which long-term care of these children would be nearly impossible. So over time, Father Dag and other people invested in Nyumbani have had to lobby for these children to have a right to have this medication. And through government expansion of funding for children with HIV, they were able to get access to antiretroviral treatment and medication, diagnostic testing, and other medical services that have expanded the lifespan of these children. So pictured here is the Nyumbani Diagnostic Laboratory, which allows Nyumbani to do testing right on site, and it also brings in a source of revenue since it's open to the public. So psychosocial. A lot of these children have experienced quite a lot of trauma in their young lives. Trauma from seeing loved ones die of HIV, from being abandoned, from living on the streets. So one of the objectives of Nyumbani is to provide a home for them that cares and gives them this parental love and care that they're lacking. So Nyumbani has a strong social services system to provide counseling and social support to the children. And the children know that the moms and uncles and any of the other staff members are always available to provide them with that care and support that they need. The vision of Nyumbani is to create sustainable communities for children infected and affected by the HIV pandemic, inspired by Christian compassion. Nyumbani was founded with the belief that despite their medical condition, these children were still children of God, worthy of care and compassion, and that spiritual care is an integral part of life at Nyumbani. From the moment they are integrated into Nyumbani, the children learn the catechism of the Catholic Church. The moms have daily prayers, the children attend and participate in Mass every Sunday, and they prepare for the sacraments. This picture here is actually children running off to Mass on Sunday. They're really excited to go. So the guiding principle behind this is to ensure that these children have a strong foundation. So even if they encounter struggles later in life, they always have this religious foundation to fall back on. So last but not least, Nyumbani enacts a holistic approach through moral care, which I have adapted as providing moral care through education. The children in Nyumbani receive education all the way through college, and then receive assistance through job placement. Currently, there are Nyumbani graduates who have gone on to get degrees in education, IT, law, and various other fields. Education is just one of the tools that Nyumbani utilizes to shape these children to their full potentials. So together, these principles help raise a whole child. Essentially, the work of Nyumbani is an example of the Jesuit tenet cura personalis, or care for the whole person. So these are just two other programs of Nyumbani, as I had mentioned previously. So Lea Toto, which means to raise a child, was started in 1998 and is comprised of 8 centers in the informal settlements surrounding Nairobi. And so the children here live with a family member, but Nyumbani covers all of their other holistic care beyond accommodation. Nyumbani Village, on the other hand, was started in 2006 and is an outreach to the 2 generations left behind by the HIV pandemic, the grandparents who lost their children to HIV and the children who lost their parents because of it. So it brings them together, and currently there are 1,000 children being served by Nyumbani Village in these clusters where there's a grandparent who basically provides that love and care and support that they need. So looking forward, of course the hope is that one day there'll be so few HIV and AIDS kids that these programs won't be necessary. That would be a really great goal to reach. But in the meantime, Nyumbani has to continue to serve new generations of HIV-infected children and continue to support those already under their care. In addition, Nyumbani has to continue to reach out to its fundraising sources, since it is 100% donor funded, to ensure that these children continue to receive the care they're getting and hopefully even improve it in the future. And I just want to say that next week, Nyumbani is actually having their annual gala in DC on Thursday. So if anybody has any questions about that, feel free to come and reach out to me if you feel like you want to support the cause. And so this is just a question that Sister Mary Owens, the Executive Director of Nyumbani, asks. if Jesus were here today, would he discriminate against HIV positive people? And that's a pretty powerful question to think about. So I would just like to thank you all.